I'm just so pleased that 2020 has been just awful, and 2021 is going to be better, and help is on its way. Now we can say, when this vaccine is rolled out, things will get better, and we'll start that process next week. So I'm obviously absolutely thrilled with the news. I'm very proud that the UK is the first place in the world to have a clinically authorized vaccine ready to go. What it means for people is that from next week, we'll be able to start rolling this out. We'll start with those who are most vulnerable to coronavirus, and you need 2 jabs, so 21 days apart. And after that, we will start protecting people as the protection comes with these 2 jabs, and it will help save lives. And then, once we've started to and protected the most vulnerable, it will help us all get back to normal and back to all the things that we love.
If all goes well, as General Perna will lay out, that means we can make our first shipments of vaccine to states this month, and we are on track to be able to ship enough vaccine for 20 million Americans before the end of the year. Of course, we're all eager to have enough supply to vaccinate every American who wants it. And because of Operation Warp Speed, we expect to be at that point in the spring.
Between mid-December and in February and end of February, we will have potentially immunized 100 million people, which is really more or less the size of the significant at-risk population, the elderly, the healthcare workers, the first-line workers, people with comorbidity.
After the initial pushes go out for Pfizer and Moderna, then every week, right, based on availability of vaccine, as Dr. Salawi alluded to, 40 million total doses in December, and then January, February, March, we are going to push allocations as vaccine becomes available. We are not waiting for a cluster of vaccine to be available and then push. We want to have this rhythmic, cadenced delivery of vaccine so the states can best manage it to the priorities as they've developed it.
We are on track to have 20 million doses ready before the end of the year. So we're already several millions ready in the fridge to go. As soon as we're going to get the go-ahead, we should be able to start vaccinating within 24 hours. That's a collaboration we've had with Operation Warp Speed in the US. The first piece, I think, is going to be extremely frustrating for the general population, that how slow it's going to feel between people reading the headlines those days that there's great news on the vaccine front, and that's another achievement of the industry.
I do think with the data we have a vaccine that is approvable that will make a dent in the pandemic, along with the vaccines from Pfizer and Moderna. And I think the supply as early in the year as possible around the world is going to be very important to try and make the dent that we need on this virus and getting us all back to a semblance of normality. Different countries and regions have different levels of vaccine hesitancy, and we need to make sure again that it's not enough to have the wealthy countries vaccinated. We have to have the world vaccinated, and so we need enough supply.